This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Welcome to Weekly Health. This is the Salamat Story of Doctors, and this are your doctors of the day. Dr. Ernest Durano and Dr. Jaya Jungal. Bring it on, Doc.
Well, narcissism, it is a excessive or erotic interest in oneself and one's physical appearance, vanity, self-love, self-admiration, self-absorption, and self-obsession. It is extreme selfishness with a grandiose view of one's own talents and craving for admiration as characterizing a personality type, and that is narcissism.
Good day, viewers! In order for a person to be diagnosed with narcissistic personality disorder, they must meet the following symptoms. Number 1, they have a grandiose sense of self-importance. Number 2, they have a preoccupied with fantasies of unlimited success, power, brilliance, or ideal love. Number 3, believes that he or she is special and unique. Number 4, requires excessive admiration. Number 5, has a very strong sense of self, of entitlement. Number 6, is exploitive of others. Number 7, lacks empathy. Number 8, they are also envious of others. Number 9, they show arrogant and haughty behaviors or attitudes. There are no treatment for narcissism, but they are required to go to their psychiatrist. And here is our next mental ailment. Please watch this.
Acousticophobia is best defined as the fear of sound or noise. Typically, treatment for this type of phobia may take months or years, and patients might be required to be repetitively exposed into their fears. The most common cause of acousticophobia, like all other phobias, is generated by the mind as protective mechanism.
It is generally accepted that phobias arise from a combination of external events. Many specific phobias can be traced back to a specific triggering event, usually a traumatic experience from an early age. So what are the symptoms of these phobias, such as the acousticophobia? As with any phobia, the symptoms vary by person depending on their level of fear. The symptoms typically include extreme anxiety, dread, and anything associated with panic, such as shortness of breath, rapid breathing, irregular heartbeat, sweating, excessive sweating, nausea, dry mouth, inability to articulate words or sentences, dry mouth, and shaking. So, are there any treatment of acousticophobia? So, medicine can be prescribed, but please note that these medications can have side effects and could cause withdrawal of systems that can be severe. It is also important to note that medicines do not cure phobias. At best, they only prevent or temporarily suppress the systems. However, there are treatments for phobias, which includes counseling, hypnotherapy, psychotherapy, and neuro-linguistic programming. So this is Dr. Ernest Gerard Durano. Back to you, Russell.